Can scoliosis actually be fixed without surgery? People ask me this almost every week. Can you fix my scoliosis without surgery? The answer is no. Nobody fixes scoliosis. Not me, not a surgeon, not a brace, not an app that sells you on posture correction on Instagram. If anybody tells you they can cure it, that's your sure sign to leave. What I can do is we can reduce the curve and stop it from progressing and keep the spine functional instead of fused. That's a very different promise, and it's one that I can actually back up. The problem with watch and wait. Here's how most scoliosis gets handled in a traditional model. Curves under 25 degrees, you get monitored. Nothing done. Curves between 25 and 40, maybe a brace, depending on age and growth remaining. Curves over 40, surgery gets seriously discussed. And past 45 to 50 often gets pushed really hard. The problem with that model isn't that it's wrong about the numbers, it's that it's a reactive model. You're waiting for the curve to get bad enough before anybody intervenes with anything beyond observation. Scoliosis is a progressive condition in a growing spine. Waiting in neutral, waiting is a choice, and it has a cost because every curve progresses unchecked tend to keep progressing. What spinal fusion actually trades away? I want to be fair to the surgical side. Fusion has a role. Severe curves. Curves compromising cardiopulmonary function. Curves that have blown past any conservative approach that can manage or influence it. And that's a real conversation, and sometimes it's the right one. But understand what fusion does mechanically. It takes segments of the spine that are supposed to move and flex and rotate and absorb load, and it locks them into a rigid position with rods and screws. You get a straighter looking spine, but you lose motion at every level that it's fused, and it's permanent. That's not a criticism of the surgery, it's just the reality of the physics of the structures. If you can't move those, you lose mobility. What a conservative scoliosis-specific is actually doing. This is where people get confused because chiropractic for scoliosis gets lumped into general chiropractic adjustments, and that's not what this is. Scoliosis-specific rehab is built around three things working together. One, corrective and scoliosis-specific exercise, not generic stretching or generic exercises that's asymmetrically loaded to address the specific curve pattern that the patient has. Two, bracing when indicated, particularly in growing patients where you still have time to influence the curve. Three, care that's actually tracked with imaging over time so you know if the curve is responding or not instead of guessing. None of that is marketed as a curve. It's a management strategy aimed at two outcomes: reducing the Cobb angle where possible and preventing progression that leads to fusion. When it works, and it doesn't work identically in every patient, that keeps the spine in motion and function, and it still moves, still adapts. That's the entire point of avoiding fusion if you can. Why this takes specific training, not just good intentions? I'll be blunt. Most providers, including most chiropractors, are not trained in scoliosis-specific protocols. General adjustments and general exercise are not the same intervention as scoliosis-specific rehab, and the evidence doesn't support it. Changing the curve size is a whole different distinction than general chiropractic. That distinction matters more than almost anything else in this conversation. So I hold a fellowship in the Clear Institute. This is advanced scoliosis-specific training, and that's why I only take on scoliosis cases rather than just standard chiropractic. Our goal is to reduce down and stabilize the scoliosis. So if you're a parent watching this, or if somebody tells you that scoliosis can be cured and you ask them what they mean specifically and you don't accept a vague answer, if your provider's plan is let's watch and wait, and if there's no plan to see how to track it and just watch it progress and nothing can be done, conservative care it might be the right place for you. It's not a guarantee, it's a decision to act early and track the curve and to preserve function instead of defaulting to the surgical timeline because nobody offered anything else. If your kid has been diagnosed with scoliosis and the plan so far has been just watch and wait, that's worth a second opinion, especially if there's growth left to work with. That's what scoliosis-specific evaluation is for. Feel free to reach out to us, 980-368-0766, or schedule a consult with us at clearlifescoliosis.com. I look forward to talking to you.